What's going on today, guys? Super excited to give you a sneak peek of the new course I'm doing with Mike Reinhold called Rehabilitation of the Fitness Athlete. So, if you've been in the fitness world yourself for any number of years, you probably know there is a general dislike from the fitness community of healthcare providers. The reason being is just because, let's say you get hurt in the gym, you go to the doctor, you go to the physical therapist, you tell them why you get hurt. They proceed to tell you, A, you're dumb, B, you should never do deadlifts, overhead press, bench press for the rest of your life, right? So we know that exercise is definitely good for us, okay? And the answer to these orthopedic injuries we find in the gym, it's not to stop, it's to keep going. Exercise is good for us. Sometimes you just have to modify and adapt a little bit for the patient. So in today's video, I just wanted to give you a little sneak peek of what we have on the inside of this course. I really think you're gonna like it. So once you log in, here's what the back end is going to look like. So you can see that we have a getting starting section, and then the first lesson is going to be Introduction to Rehab of the Fitness Athlete, and all you have to do is go ahead and click on this. Once you're there, we have an introduction video from Mike Reinhold talking about the importance of understanding the specific demands that the fitness athlete goes through and how you need to know this in order to rehabilitate properly and also to prevent future injuries. All the modules within this course are delivered via video, and once you're finished, all you have to do is go ahead and click on the complete and continue button to advance. After you finish up with the introduction, I go on to talk about why injuries happen in the gym and what to do about it. Now, if you've been in the rehab world for the past 5 or so years now, you'll know that technique is not the only reason why folks get hurt, okay? It's not all about lift the neutral spine, lift with your legs. Even if you do that, you still run the risk of getting hurt while you're deadlifting, right? Plus, when you are deadlifting, you can't really use your legs as much as you might like to, right? So there's a lot of reasons why folks get hurt in the gym. And in this little course, we'll talk about all of these specific parameters and what to do about it so you can help your patients not only rehabilitate, but also stay a little bit safer in the future. There are a few very good articles that we have inside of this course. I would say as a sport, the fitness athlete, we don't have as much research on that population. However, we do have some decent literature they should be aware of. We've included in this, and it's part of the curriculum. So I definitely think you're going to get a lot out of it. Once you finish up with reading the articles, my next section is going to be about rehabilitation principles. And this is also one of my favorite things to chat about. We'll basically break down rehabilitation of the fitness athlete. We'll make it very simple. We go over things like modifications for folks that have pain so they can keep on working out in the gym, how to unload these folks, how to progress them over the course of time, how to advance them finally back to their sport, right, or their fitness of choosing. After we get the theoretical, practical stuff out of the way, it's down to the nitty and gritty. We break down the squat and we go A to Z. So basically the difference between a squat for a powerlifter versus a bodybuilder versus Olympic weightlifter, and then how you can modify this over the course of time. We have a lot of very specific aspects like regional interdependence, how altering your squat technique is going to shift stress in different areas. We go over how mobility restrictions are going to lead to more or less stress in given areas and how to correct that. We go over femur length and torso length and how that's going to affect stress on the body. We really go very far in depth. And as you can see here, we start talking about pain and how squat technique is going to impact knee pain, hip pain versus low back pain, and how we can adjust and modify this over the course of time. Lastly, we go over a nice mobility program for you, so you can go and see exactly how I like to mobilize my athletes to get them in better positions to squat. We also have a return to squat program. So after we go through all the minutia about the squat, I have a program written out for you, and it's pretty much the same program that I use for my athletes after they have some sort of injury. Let's say they have low back pain, they're getting out of pain, they want to ramp back into the squat. This is the program that I use, and you guys have access to see that. After we went super in-depth in the squat, we do the same exact thing for the deadlift. We talk a bit about the different types of deadlifts. So you have a deadlift for a power lifter. You also have a deadlifter for Olympic weightlifter, which is going to be a little bit different. The bar path changes slightly. We have technique that changes for sumo deadlift. We go over the different variations when you would employ them. And we'd also talk a little bit about which variations are going to be involved with different pain problems. For example, a sumo stance, sumo deadlift is going to be a little more challenging for the hip than a conventional stance. So if you're dealing with a sumo deadlifter that has hip pain, then chances are they're going to have to take a look at their sumo stance and maybe modify things accordingly, right? But it's important as a practitioner that you understand the nuances between the lifts, right? So like I said, we go very far in depth breaking down the deadlift. So we talk about stance, we talk about grip width, we talk about finding a neutral spine in the deadlift. If you have someone who can't find a neutral spine, how do you regress that movement and teach them how to find it? If there's a mobility restriction that's keeping them from getting to a neutral position, how do we mobilize that and then teach them how to get in a better position over the course of time? We also talk a little bit about core bracing, using a lat lock to try to engage the lower back a little bit better, create more stiffness so you can lift some heavier weights and keep your back a little bit safer potentially. We talk specifically about deadlifting for Olympic weightlifters because it's really a different bar path and it's a different lift altogether. It's important to understand that. Then next we go over common errors in the deadlift. So there's a lot of variations of the deadlift that can be healthy for the body. It's just that optimal position for lifting as much weight as possible is going to be a little bit different than just lifting for enjoyment. So if you have an athlete that's trying to pursue a high level of competition, there's going to be a specific technique that's probably going to be a little bit better than others, right? We need to understand these nuances. Next, again, we chat more about the sumo deadlift. We talk about hip pain that's associated with the sumo deadlift. We talk about low back pain that's associated with the deadlift in general, and we break all that down in depth. Just like in the squat section, we go over mobility for the deadlift. You have an individual that's having a hard time getting to the bottom position of the deadlift and keeping a neutral spine. Give you an exact program that I use for my athletes to help get them in better positions for the lift. Then lastly, I give a return to deadlift program. So essentially, you have someone that had low back pain. They're out of pain. They want to get back to deadlifting. This is the program that I use for my athletes. And I'll show you exactly how I do it. And last but not least, we go over the bench press, everyone's favorite movement in the gym. We go over optimal bench press technique, how altering your technique is going to change the stress on the body. We go over modifications. So if you have someone that has shoulder pain during the bench press, which modifications can we try to continue having them work towards their training goals while simultaneously rehabilitating? We talk more specifically about pec injuries and AC joint injuries. And then lastly, we talk about lower back pain, which is actually a fairly common thing you'll find in people that bench press. And despite the bench press being upper body exercise, there are very specific stressors on the spine during the bench press. And we'll show you why this is occurring and what to do about it if your athletes are experiencing this. And lastly, just like in the other modules, we also have a return to bench press program. So if you have an athlete that has shoulder pain and they're getting out of pain and you want to get them back to bench press, this is the exact program that I use to do that. And lastly, when you finish up, there's a post-course evaluation. You'll have to complete this with a 70% or higher grade in order to get the CEUs for this course. We have a ton of CEUs for physical therapists, physical therapy assistants, as well as athletic trainers. So I'll give you all the information on how to submit for that. And there you have it. It's your sneak peek to rehabilitation of the fitness athlete. If you work with anyone in the strength and fitness realm and you want to learn how to do a better job, both as a coach and clinician, I definitely recommend you checking this out. And I'm pumped to have you.